This film is part of the series in crisis management in the operating room. Today we will explore the intraoperative allergic reaction. Understanding the key clinical signs and familiarizing yourself with best practice interventions are essential steps to preventing loss of life during an anaphylactic emergency. Pay careful attention as we first demonstrate what can go wrong.
I'm so excited. I just cannot wait to get into the OR.
Okay, well, calm down.
Okay.
Before we get in there, we have to go do, per policy, we have to do this pre-op interview.
Okay.
I know it's kind of stupid, but there are just some silly questions we have to go ask our patient, make sure that we're good to go.
Okay.
You ready? You're
Yeah.
Jesse. I'm going to be doing your anesthesia today.
Okay.
This is Megan. She's going to be helping out.
How you doing?
How you feel this morning?
Feel great.
What we haven't done today?
I have my left knee work on me.
Okay. Have you eaten anything today?
No.
Nothing all morning?
Nothing all morning.
Okay. But you feel good?
Feel really good.
All right. So Mr. Smith feels pretty good.
Okay.
No reason to give him the benzos. Just put
All
them
right.
in your pocket. Save them for later. You ready to go?
I'm ready to go.
Let's get you wheeled back
All
there.
right, let's go.
This team neglected to perform a complete evaluation of the patient and have missed a key risk factor for anaphylaxis. The patient had surgery 2 weeks ago. This length of time is the most optimal incubation period for the development and expression of a drug allergy. At a minimum, this assessment should have included an airway assessment, allergies, ate or the last meal, anesthesia, and surgical history.
So, Megan, tell me what your plan is.
So I'm thinking general anesthesia and definitely intubating. I'd love to intubate.
Yeah, no. So, there's really no reason to intubate this patient. He's a 27-year-old healthy male. I don't really feel like we need to establish a secure airway. I think that we'll be fine just using an LMA. But I think general is a great idea. So why don't you go ahead and get your drug set up, and
Okay.
I'm just gonna be over here. So what do you think?
Perfect. Just gotta get out some propofol and some succinylcholine.
Is she new?
And
No,
some
she's new, that's
fentanyl
Okay, okay.
and
Yeah,
an antibiotic.
You're good. Do you feel okay still?
I feel great.
Yeah, you're gonna do
I
great.
feel fantastic.
Let me know if you think that you need some oxygen. We can give you some.
Okay, now I'm pretty good.
Okay.
Okay. I think I have everything.
What are you waiting for? Just go ahead.
Okay.
Yeah,
All
just
right.
go ahead.
All right. I'm just gonna give you some medication, sir.
Okay, do you know what kind?
Just take some deep breaths.
Okay.
Okay. I gave them all.
Did you call the doctor?
No, I didn't. I didn't
don't
notice-
worry. No, it's okay. Don't worry about it. I'll get him on the
Okay.
phone. It's okay. Dr. Taz? Do you think you could come into OR4? We're ready for you, so we can go ahead and get started. Well, we already started, but just get in here whenever you can. Okay, bye.
What could this team have done differently? Preparing for a patient with known risk factors for allergic reactions in the OR may include administration of a benzodiazepine, which will blunt the histamine release caused by induction agents and opioids, planning for a secured airway, avoiding known offending agents, and having emergency medications drawn up and ready if necessary. The two most common anaphylactic reactions in the OR occur in response to paralytics and antibiotics. It is therefore essential that we allow for time to lapse between administration of the two. Although many of the signs of anaphylaxis may be masked by the expected physiological changes of induction, this patient is exhibiting all of the classic symptoms of an anaphylactic reaction. As we return to the action, look closely at his skin. You can see wheals and urticaria. Pay attention to his changing vital signs. He's becoming tachycardic and hypotensive. Finally, be aware of the ventilator. As bronchospasm sets in, you will see decreased tidal volume.
Hey, what's going on in here?
We just got started. We were waiting for you.
Okay, all right. What's going on with his vital signs over there?
Oh, I my God, I didn't even notice. What did you do to this patient?
I don't know. I just gave the medications that we usually give.
It's okay. It's fine.
What medications did he give?
I gave that pain medication, I think fentanyl, and then that white medication that just makes you really sleepy, and then that one medication that just makes your muscles relax.
Does he have any
And
allergies to anything?
His chart didn't say he had any allergies.
His chart didn't. Did you ask him if he had any allergies?
His chart said he didn't have any allergies.
Okay. Well, all right. Do you see that? He's got.
Oh,
Yeah.
that's gross.
He's got a little rash. Yeah.
Yeah.
Yeah. Can you draw up the emergency drugs?
She should have the. Where are your emergency
Oh no,
drugs?
I'm sorry. I didn't know.
Give
Hold
me
on,
a
I
second,
can get it. I
it's
can do
gonna
it.
take a minute.
Which one is it? Which one
Okay,
is it?
calm down. It's okay.
Okay.
Just drop the epi.
All right. Drawing it up.
Yeah.
Okay.
You got it. Just forget it. Just forget it. It's too late.
Well, why don't you go talk to his family? Okay. It's okay. Sometimes it happens. Don't be upset. It's okay.
Anaphylaxis is a severe allergic reaction that can be life-threatening with rapid onset and can occur with or without exposure to known allergens. It is fatal in approximately 10% of cases and results from cardiovascular collapse. We've already discussed assessment of risk and appropriate monitoring. What response should the CRNA take to anaphylaxis? First, all drug administrations as well as surgery should be stopped immediately. The CRNA should begin administration of 100% oxygen. Depending on the severity of the hypotension, IV epinephrine should be given. IV fluid should also be running wide open or as tolerated. Antihistamines and glucocorticoids may be given to assist in reversing any hypotension that is refractory to epinephrine and IV fluid replacement. Now let's take a look at a situation where the team is prepared, knowledgeable, and confident in the appropriate actions to take in responding to an anaphylactic crisis in the OR.
There are definitely some things that we need to do before we get him back to the OR.
Okay.
We need to conduct an airway assessment. We need to see if he has any allergies.
Oh, yeah.
We need to ask about any sort of anesthesia history. And we
Okay.
need to make sure that we know the last time that he had anything to eat or drink. It's also really
Okay.
important to conduct a full history, pretty much a head-to-toe assessment, because we really just want to go into the OR as prepared as we can with everything that we can know about this patient. And then we're going to take a listen to him, make sure everything's good to go, make sure that consent has been signed,
Okay.
ask him if he has any questions, make sure that he's feeling comfortable, because
Okay.
patient safety is our number one goal.
Sounds
And then
great.
we'll take him back to the OR and we'll get started.
Okay.
You ready?
Yeah.
Let's do it. All right, Mr. Smith, we're going to get you hooked up to some monitors and then set up our stuff back here, okay?
Okay.
All right, so Megan, I know that we already discussed that we're going to be doing general anesthetic today.
Right.
So why don't you go ahead and set up your cart.
Okay.
I'll go ahead and put this oxygen on Mr. Smith, and then
Okay.
once you're ready, we'll call Dr. Taz.
Okay. Perfect.
Just going to put this oxygen, try and take some deep breaths for me, Mr. Smith, all right?
Okay.
You're going to do great today.
Oh yeah.
Oh, yeah.
Okay. I think I have everything that I need.
Okay, do you have your emergency drugs set up
I
too?
do,
It's
yes.
important to always have those out on your
I
cart.
do.
All right, let me go ahead and call Dr. Taz.
Okay.
Dr. Taz, we're ready for you in OR4. Okay, thanks. See you soon.
Did you guys review induction medications we'll be using today?
Yeah, so this is Megan. She's our student, and she's going to be helping today.
All right, excellent.
Nice to meet
She's
you.
got all of her drugs pushed back here. We're just
Perfect.
waiting on you to get started.
Perfect. All right, I'm ready when you guys are.
Okay.
Okay, go ahead and get in there and push your meds.
All right. Just gonna start giving you some medications to help you relax. Okay.
All right.
I'm gonna give you some fentanyl and some lidocaine and some propofol and then our succinylcholine.
Night. Well, it looks like our blood pressure's dropping a little bit.
Yeah, definitely.
He's getting pretty tachycardic too.
I'm gonna take a listen to him and see what. He's got some upper airway wheezes. Sounds like a bronchospasm.
Okay. He's also got this funny looking rash.
Yeah, looks like an allergic reaction. What medications we gave? The succinylcholine, the propofol, the lidocaine, the fentanyl?
Yeah.
Yeah, we
Is
hadn't
that
given
right?
our antibiotics yet.
Excellent. Good choice. All right, so it looks like its most likely cause is the succinylcholine.
Okay.
All right, so we have an allergic reaction. It's okay.
It's okay. We're just gonna give him 100% oxygen.
Okay.
Let's go ahead and open our fluids wide. Megan, why don't you go ahead and administer the epidose that you
Okay.
prepared, and I'm gonna
Okay.
drop 25 milligrams of
Okay,
Benadryl.
perfect.
Why don't you hold this, Dr. Taz? Thank you.
All right. Epinephrine is in.
Here's your Benadryl.
Okay. Perfect. Benadryl's in.
Well, looks like his heart rate's resolved.
Heart
We'll
rate's coming
cycle a new
down.
blood pressure. Do you want us to go ahead and call for an ICU bed?
Yeah, let's go ahead and get him in the ICU and see what their team says.
Okay.